Babies cry for many reasons. It could be because they are hungry, tired, or need a diaper change. Sometimes a baby's cries are different. They might be louder, more intense, and harder to soothe. The cries are more intense and frequent. This might be colic, a condition that can be very distressing for both the baby and the parents. Colic is common in young babies. It affects about 1 in 5 infants. It is not a disease, but rather a pattern of behavior. Colic is a temporary phase. It will eventually pass, even though it may feel overwhelming at the moment. Colic usually starts a few weeks after birth, often around the 2nd or 3rd week. It often peaks around 6 weeks of age when the crying can be at its worst. Most babies outgrow colic by 3 to 4 months old, and the crying episodes gradually decrease. Parents often feel stressed and helpless when their baby has colic. It can be a very challenging time. Please know that you are not alone. Many parents go through this and there is support available. Colic is not your fault. It is a common issue that many babies experience. It does not mean you are a bad parent. You are doing your best, and that is what matters. There are ways to soothe your baby and cope with colic. Techniques like swaddling, rocking, and using white noise can help. This essay will explain colic in more detail and offer helpful tips to manage it, providing you with the support you need during this tough phase. How can you tell if your baby has colic? Colic has specific patterns. Colic often appears in the late afternoon or evening. Babies with colic cry intensely. The crying may sound different from usual. A baby with colic may clench their fists. They might drop their legs to their tummy. Their tummy might feel hard. Babies with colic may pass gas. These symptoms appear with no clear cause. Your baby is otherwise healthy. They are feeding well and gaining weight. If you are concerned, talk to your pediatrician. The exact cause of colic is unknown. However, there are some possible explanations. One theory is an immature digestive system. A baby's digestive tract is still developing. This can cause gas, bloating, and discomfort. Some babies might be sensitive to substances in breast milk or formula. Certain foods in the mother's diet might bother the baby. It could also be related to an overactive nervous system. More research is needed to fully understand colic. It's important to remember that colic is not caused by anything the parents did wrong. Section 4. Soothing a colicky baby. Dealing with a colicky baby can be incredibly challenging and stressful for any parent. There is no one-size-fits-all solution for colic, as every baby is different and may respond to different methods. However, there are several things you can try to soothe your baby and make them more comfortable. First, try to create a calm environment. This can help reduce overstimulation, which might be contributing to your baby's discomfort. Dim the lights and reduce noise. Swaddling your baby snugly in a blanket can also help. This provides a sense of security and can mimic the feeling of being in the womb. Gentle rocking or swaying can be very calming for your baby. Try holding them close and moving rhythmically. You can also try giving your baby a warm bath. The warm water can be soothing and help them relax. The warmth can help relax your baby's tummy muscles, which might be causing some of their discomfort. Some babies find relief from sucking. It can be a natural way for them to self-soothe. Offer a pacifier or allow extra breastfeeding sessions if your baby seems to need it. If you are breastfeeding, talk to your doctor about your diet. Certain foods you eat might be affecting your baby. They can help you identify any potential trigger foods and suggest dietary changes that might help reduce your baby's colic symptoms. Section 5. Finding support and reassurance. Dealing with a colicky baby can be incredibly challenging and exhausting for any parent. It's important to remember you are not alone in this journey. Many parents have faced similar struggles. Reach out for support from your partner, family, and friends. They can offer a helping hand and emotional support. Don't be afraid to ask for help when you need it. It's a sign of strength, not weakness. Take breaks when you need them. It's essential to recharge and take care of yourself. It's okay to put your baby down in a safe place and step away for a few minutes to gather your thoughts. Remember that colic is temporary. It will eventually pass. Trust your instincts and stay hopeful. You know your baby best. Your intuition is a powerful tool in understanding their needs. If you are concerned about your baby's health or behavior, don't hesitate to contact your pediatrician. They can provide valuable guidance and reassurance during this challenging time, helping you navigate through it.